Hey guys, I wanted to do a little sit down video with you and talk to you about the things that I have learned about taking care of Jackson these short 2 months that he's been born. Jackson has hypoplastic left heart syndrome. He's doing great right now. We have been discharged from the hospital for 2 weeks and everything is just going smoothly. First and foremost, I want to say that if you're watching this because you're having a hypoplastic left heart baby, I want to say that every HLHS case is different. My story is not going to be your story, and Jackson's journey is not going to be your child's journey, because every child's HLHS defect is different, whether it be a mild difference from Jackson's or a significant difference from Jackson's. But let's get started. Jackson has HLHS with mitral atresia and aortic atresia. Atresia means small, so his mitral valve is small and his aortic arch is small. The first time I seen Jackson was mixed emotions. There was the emotion of total and excitement to see my baby, see what I had been growing and creating, and seeing all his little fingers and all his little toes. But then there was the emotion of fear and being terrified, because he was literally on death's doorstep if it wasn't for modern medicine. Even now he could pass away at any time, and that's the fear that every parent is going to go through with a heart baby, whether it be a mild defect or a severe defect. Jackson had his first surgery at 6 days old. Leading up to those 6 days, he progressively got worse, just like any heart, HLHS baby will do. They progressively get worse until their first surgery. He looked perfectly fine at the beginning. But as a parent, you know your child and you know when they aren't feeling very good. Around 3 days old, was the first day that I really noticed that he wasn't doing well. The doctors came in and talked to us and said that they were worried about his labored breathing. It could mean a multitude of things. So that he had O2 sensors everywhere on him. O2 sensors measuring the oxygen level going to his brain, O2 sensors measuring the oxygen level to his organs, and he had an pulse ox on his foot, on his arm. They were just monitoring everything. He had, monitors everywhere, and he would have apnea spells where he would stop breathing. What the doctors told us, he was oversaturated, meaning he had too much oxygen going through his body, because with hypoplast babies, the pressures in the heart mean it is not, having too high pressures in the heart is not a good thing, and so they were worried about that. What was happening with the labored breathing is he was retaining fluid, and that's what a lot of HLHS babies do, is they retain fluid. His case wasn't as severe as some of the other babies that I've seen. Some of the other babies that I'm following on Facebook. One little girl, she ballooned up. She looked like Pillsbury Doughboy. She was so puffy from all the fluid she was retaining. So they started him on a medication called Lasix. It's a diuretic medicine that helps his body remove the fluid and urinate it out, which also causes his kidneys to work harder than they would have to normally. So that is a side effect of it, is, kidney decrease in function. But he responds very well to the Lasix. So they didn't have to intubate him, which is put a breathing tube in, which is, the doctors told us that they were really considering it if this Lasix didn't help. Thankfully it did help, so he did not have to ever be intubated before surgery. He was scheduled to have surgery on Monday at 5 days old, but some things came up. Another baby was more critical, which happens. You never know when they're going to have surgery until they will them back, is what I have learned. He went back at 6 days old at 7:30 in the morning, so he was in reality 5.5 days old. But anyways, 6 days old. At Texas Children's in Houston, where we are, a surgeon's nurse will come out every hour and a half to 2 hours to update the parents on the progress of the surgery, which is amazing because it makes us feel, as part of the surgery, it keeps our stress level down, even though it is already through the roof. It helps give us a little bit of peace knowing how things are going. And the last update is the surgeon will come out and talk with you. They bring you into this little consultation room and they just talk to you about the progress of the surgery and the things that they found and everything. So when Dr. Henley, Jackson's surgeon, came and told us that surgery was successful, everything went smoothly, and just, filled us in on everything. Wanted to give him a hug, but he didn't. He doesn't appear to be the hugging type. So we shook his hand. We thanked him so very much for his knowledge and his steady hand. And when he left the room, Jason and I stood up and we were just gonna leave the room, and I couldn't move. It was like my feet were nailed to the floor, and I just raised my hands above my head like I had just won the Ironman competition, and I hugged Jason, and it was an amazing feeling knowing that he had come through surgery successfully, no hiccups along the way, and it would still be another hour and a half before we could go up to the CVICU to see him again. When we got there, nothing prepares you to see your baby that way. No matter how many pictures you look at, and how many moms that have went through this you talk to, and how many videos you see, nothing prepares you to see your baby that way. The best way that I can describe seeing him that way is lifeless. If it wasn't for the beeping and all the monitors showing that he was alive, you wouldn't know it. Or the nurse is steadily telling me that she's trying to get everything situated, get everything set up, and so that helped keep my mind focused on that instead of losing it. I just wanted to collapse, cry. Once I seen him and got used to seeing him that way, you look at him and you can see the heartbeat through his chest, and it was beating so fast, and he was intubated, and he had a feeding tube in, and because he hadn't been he was only on what they call lipids and TPNs, which is an IV nutrition. He hadn't been allowed to have any breast milk until 8 days old. Um, and then even then, that was through the feeding tube, and it was, very slow progress to get him to full feeds. He's sleeping. So where was I? Because he was intubated, and at the things down his throat, it was causing a little bit of scratching on his throat, which, he was doing this like suckle reflex, and it was, they were a little concerned about that. Maybe he might have had a stroke or something during surgery, a mild stroke or something, so they did an ultrasound of his head. It came back completely normal. Just he like suckled for almost 3 days, just a constant suckle. He was sedated for a few days, and during those days, I was by his side every day in the hospital. The only time that I wasn't there was when we were sleeping, because you're not allowed to sleep in CBICU with your baby, but you are allowed 24/7 access to your baby unless they're doing a sterile procedure, and then you are asked to leave. I wanted to say that Dr. Henley did close his chest after surgery. Some babies, their chest is left open because they fear that they might have to come back in and do a little bit of extra work, but Jackson's chest was closed. He has there's 2 types of shunts that are used for the Norwood procedure. It's the first surgery. There is the BT shunt, and then there's the Sano shunt. Jackson has the Sano shunt, and is one of the larger shunts. It runs from his right ventricle up to his pulmonary artery. After surgery, his oxygen levels decreased into a normal range of about 85 to 95. Now they hold steady about the mid 80s. If he gets upset, they do drop into the 70s. But other than that, after surgery, he slowly came off all the medications, most of the medications, not all of them. He still does take some medications. He was having a lot of arrhythmias called PVCs, meaning that he was having a small extra heartbeat in his normal rhythm. Doctor said that everybody has PVCs, whether they realize them or they don't. The thing with Jackson's PVCs is they progressively became more frequent. He was having up to 42 a minute. So they did an echo of his heart and found fluid around his heart. So I believe that was 6 days later from his surgery, and he had to go back into surgery for a periocardial infusion with the fluid around his heart to remove that fluid. They drained about an ounce off of his heart. They had to go back in and put another drain tube in. This was after he had all the other drain tubes out, and his dialysis was done. So that was a setback. He hasn't had any problem with the periocardial fusion since then. Jackson does have arrhythmias. He was started on a medicine called propranolol. It is a beta blocker. It has mixed blessings. It can help the arrhythmias, decrease, but it also can cause a decrease in heart function. But the arrhythmias can cause a decrease in heart function, and the propranolol can also do that. So it was stop the arrhythmias and risk, heart function decrease, or keep the arrhythmias and get a decrease in heart function. So So we did start the propranolol. It did its job. Jackson's heart function is still great, and he's still taking the propranolol. We might stop taking it next week. We started on a low dose to help prevent a decrease in heart function. He's still on the low dose at 0.04 milliliters 3 times a day, but the dose to his weight is so low it's not doing anything. I mean, it shouldn't be doing anything. So we had a Holter monitor last week, and once the results come back, we'll either see if he's still having the arrhythmias or if his heart just outgrew the arrhythmias. If he's still having the arrhythmias, we'll adjust his propranolol to his weight and continue doing that. If he's not having the arrhythmias anymore, we are going to stop the propranolol. So coming out of CVICU, we went to step down on the 15th floor. It is where I resume all care for Jackson. I want to tell you this. I want you, if you're going to go through this, you need to get to know your baby just like they were. You need to get to know them, know their breathing, know their color, know their normal temperature by feel, know how they feel, and this way when you do go home, you will know your baby. There's some of these babies that get left at the hospital, and I mean, their parents aren't able to come visit them, or they choose not to visit them because it is hard to see your baby this way. But it is very crucial that you know your baby and you know your baby's stats. When we went down to the 15th floor, it's where I resumed all control of Jackson. I gave him all his medicine, his bathing, and we acted like a family just in a little bitty hospital room. In CVICU at Texas Children's, the nurses are more than happy to let you take care of your baby. I changed all Jackson's diapers. I fed him when we were there, of course, and not sleeping. I gave him all his bottles. I changed all his diapers. I bathed him in CVICU. I held him as much as I could before surgery, and then once he was able to be held after surgery, after he got extubated, took the breathing tube out, I held him as much as I could then too. So on the 15th floor, we acted like a family. The nurses came in and brought his medicines. I checked the dosage because everybody can make a mistake. Gave him his medicines, did everything for him, and eventually, after we found out that the propranolol was not causing any more problems, we went home. And we went home on the medications of propranolol, Lasix, a quarter of an aspirin a day, a multivitamin, and he also went home on some gas drops. Oh, and Zantac. We have since dropped the Lasix. He doesn't take Lasix anymore. We upped his Zantac for his weight, so he gets that twice a day. He gets the propranolol 3 times a day, as I've said, multivitamin once a day, and the gas drops are just to help with his gas, because he is a gassy baby, but that's because of his genetics. His daddy is the same way. But we are just a family. This is a long journey, and it is difficult, and it's going to try you and make you go insane and make you cry and make you wonder if you can still go on and do this. This journey is filled with tears and laughs and anger. But this journey is doable, and anybody can do it. Your life is going to change. You're going to get a new normal. It's doable. You can do it. I have faith in all of you. I have been through a lot this past year, and if you don't know, my husband and I lost our first son at 20 months old in a car accident, and we went through that, and we made it through that, and we can make it through this, and we can be a family and survive and live, and it makes you appreciate every minute with your baby. So do it. Just do it. There are still days when I just want to say, enough. I'm done. And then I see him smile. He is a baby with medicine. That's all I can tell you. A baby with medicine. But guys, I think this video is long enough. If you have any questions, feel free to ask in comments below, and I will answer them. I want to help you get through this. But just know, I am taking care of a newborn, and I am taking care of a heart baby, and it might take me a little bit to get back with you, but I will get back with you, I promise. And I will going to continue making videos like this, so maybe one day, once I get enough questions, I can go through and just make a Q&A video. So every question is there, and people, future people just don't have to read through the comments anyways, blah, 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 blah. I can keep on yakking. Guys, I thank you for watching this video. Give me a thumbs up. Subscribe to me if you want to continue watching our journey. And I will see you on my next video. Bye.